Hello and welcome to a Business Minute with Lily Lopez, presented by the South Florida Hispanic Chamber of Commerce here at the beautiful Biltmore Hotel with Dr. Ilana Vaca. She is with IVMD, and I love that. I love that name, IVMD. She's the sister of a very dear friend of ours. Everybody knows her, Ilana Vaca, whom we love very much, and her father's a doctor. So they have a very nice practice. I've been there many times, and I want just to talk to her about your specialty. When it says IVMD, what does the IV mean?
Yeah, so we're a concierge internal medicine practice, but we have a little bit of a twist to our practice where we like to integrate and blend some new cutting edge integrative therapies.
Oh, okay.
So,
And what is integrative therapy
Yeah.
for those who are watching?
So we include IV therapies, so IV infusions.
That's important.
IV prescription infusions. We have vitamin blends that are really personalized to the patient. We offer peptides and other weight loss medications and programs. So we're just really trying to target and really encompass the entire patient.
And
as
it's
a whole.
all focused towards health.
Health.
Healthy, maintaining your health and eating healthy.
Yes.
And the IV. So tell me, what do the IVs do? Because I've heard so much about that,
Oh,
Ilana.
yeah.
So
We have people to come in for energy boosts. You know, they're trying to battle chronic fatigue. We have something called CEO syndrome, where you're just at this chronic stress level. And so we have a lot of IVs and some protocols that really target them. We have some for women, for hair, for skin, for energy, your immune system. So we really just...
And do you see, how do you see the results when the patients have go through that therapy and then they've been with you like for a month or two? Do they feel
Absolutely.
that they've improved in their health?
I don't like to say it's immediate, but we really do see an improvement in people in all aspects.
Of course,
And you know, that's very important for us. Being healthy means that you're also happy, and we want you to feel good, but we want you to feel good from the inside out. So we really like to combine the traditional medical care and then also add this new, you know, more holistic approach to our practice.
The holistic approach is something that's very trendy and people are liking it a lot. I happen to like it because Hispanics, like my mom and dad from Cuba, they always firm believer of vitamin B12 and the B12 shot and all of that.
Yeah.
So tell me about that. I mean, we love the B12.
Yeah.
What does it do?
So B12 really, it's something that you can only get in a very specific manner with protein, and our stomachs are always inflamed. Our gut health is really important.
Exactly.
So a lot of people are deficient from vitamin B12, and it helps with energy, your vascular system, your neurological system. It helps with clearing up that brain fog. So we also offer other vitamins as well, NAD, or some people call it NAD.
What is NAD?
NAD's this molecule that every cell in your body uses for energy. So
I didn't know
when
about
you
that.
start,
We're learning.
So when you
NAD.
start this, which is like small little injections that you can do, or you can also do them IV, you start noticing a difference in your sleep is better, your quality of sleep is better, your skin is glowing. You feel like when you're 20 years old, that just energy boost, and you wake up with like a clear mind and you're ready to go. So it's a really great therapy.
And Ilana, just going deep and just what we've been reading lately, that cancer has increased like 27% among younger people.
Yes.
So tell me about that, because we're seeing a lot of cancer.
We have, and it's just really sad. And it's not just genetics. Genetics encompasses maybe less than 5% of cancers. And then it's a combination of environmental toxins, food toxins. You have viral and bacterial toxins that can contribute to cancer.
Also?
They're finding.
So maybe a virus or some bacterial infection that you have to trigger it?
Yeah, for example, COVID is one of those viruses that they're starting to see that may be oncogenic. It can really suppress your immune system and create an environment where cancer can grow. So we want to really target that. There's ways where you can clear the virus. There's ways where you can enhance the good parts of your body to help battle these kind of illnesses, and you can prevent it. So
yes, that's the big increase. And excuse me, and I've read about it so much, and it's concerning. And about the water that we drink.
Oh, absolutely. The water, our quality of water
is
really bad. It's hard saying that because, you know, you don't want to scare people and you don't want to get stressed out.
Right.
But...
And the plastic.
Yeah, the microplastics that we're seeing sometimes antidepressants in our water.
Really?
Yeah.
Oh.
Like we're seeing all this because they dump medications into the ocean and things like that. So, you know, your quality of water is really important. So we're really trying to focus on bringing it down to the basics.
So Ilana, yeah, we want to have you one day speak to the chamber, to the members, and especially to the Hispanic Women's Society Network, our women's committee, because women are the ones that really protect the children and their families.
Yeah,
And
absolutely.
to learn more about what's going on, because it's shocking to me. I read and I'm informed, and I see that everything has just changed for the worse,
Yeah,
right?
we're just noticing a lot of things
A lot of things that are different.
and now over time
A lot
we're
of
seeing,
autism.
yeah, a lot of autism,
A lot of
which
immuno
compromised people. So,
exactly.
yeah, so we like to focus on boosting the immune system in a natural way that's synonymous with your body.
Natural.
So it's more natural. So you're just mimicking what your body already does. And really, we started this and integrating this because we saw a gap, especially with women healthcare,
Exactly.
where your symptoms were being ignored. So you were
Exactly.
told a lot. It was normal
Yeah.
aging.
Yeah,
like this
primary.
normal aging. Oh yeah, your
Exactly.
mood should be going
Your
like
mood-
this.
exactly, no.
But no, absolutely not.
And
there's ways we can
there's
optimize your
way.
hormones and just make you
Exactly.
feel good. And especially menopause, you do not need to suffer. Like
Right,
there's
exact-
ways
there's
where we
ways.
can really manage you. So
And cholesterol, I for one had high cholesterol because that's genetics, because of my father. Excuse me. And I remember that I started taking this natural over the counter.
yeah,
That my cousin of mine,
niacin's a great supplement.
the one that I'm
actually.
taking is called cholesterol. I mean, they should.
Yeah,
I'm
yeah.
announcing you. So anyway, it elevates the good cholesterol, and
Yes.
once the good cholesterol is very high, the ratio of cholesterol drops.
Yep.
So I got rid of the statins because it was affecting my liver enzymes.
Yeah.
So there's so many things that we don't know about that sometimes doctors that are not like you don't get you into these medications. And I like what you're doing because you're looking outside of the box and you're seeing alternatives for patients. That doctors usually they just say, oh, you have high cholesterol here. Start taking a statin. Why?
No.
Why?
Yeah, we have faith in our patients.
Yes.
We have faith in you that you're willing to make the changes. And we'd like to start from, the most natural and safe and then move on up to just see where you're at. So something like that is great. Yeah, good job, Lily, for
Well,
learning it.
I want to thank you for being on a Business Minute. We
Yes.
overextended ourselves because usually it's shorter, but it was so interesting. And we'll do more later on with the
Awesome.
Hispanic
No,
Women's Society Network. Yes,
Thank
absolutely.
you. And it's an honor being here. And thank you very much.
My pleasure. Thank you. And we'll see you all next week. Thank you for tuning in to another episode of A Business Minute with Lily Lopez.